ladies and gentlemen. On behalf of the Integrated Health and Wellbeing Council, I welcome all of you to this breast cancer awareness series, which is an initiative supported by Roche. I'm your host, Dr. Behjat, and today we'll be discussing about empowering women understanding and mitigating breast cancer risk factors. And to discuss about this very pertinent issue, I have with me Dr. Santosh Kumar Chellapuram, who's a consultant medical oncology and BMT at Star Hospitals. Welcome to the discussion, sir, and thanks for taking out time for your busy schedule and joining us for this awareness session.
Thank you very much for having me. I really thank for you to take up this initiative, especially after the International Women's Day that we celebrated yesterday. And it's a very, very important and a pertinent topic that every woman should receive the knowledge and empower themselves so that they can understand how we can detect early and what are the risk factors so that we can cut down the risk factor and prevent the disease that actually occurs.
Dr. Santosh, thanks for that introduction. So starting with the first question, when we talk about breast cancer, so we'll come to the risk factor part also during the later part of the conversation. But when we talk about breast cancer, how will you define it for a person who is, not too much into the technicalities of things? Breast cancer, एक simple उसमें आप किस तरह define करेंगे for the awareness of our audience?
So cancer is something where there is disorganized growth. So that is implication of cancer, जो normal चीज में हम discuss किया. So generally, whenever a person is growing, just a small child say when he becomes big, there is an on button, there is an off button. Suppose he achieves so and so height, automatically the growth stops. But in cancer, it's a disorganized growth. There is no stop signal. So whenever there is a small cell that is present inside the breast, it goes in a disorganized manner. So that is what we call as cancer. Initially, it spreads in only the breast. Later, it slowly enters the blood vessels that are beside the breast and it circulates in entire body circulation and spreads to other part of the body. To simplify, it is a disorganized growth. Initially starting at the place where it starts and later spreads to other parts of the body. There is no stop signal. There is always continuously on. Suppose if there is a car with a jammed accelerator or brakes are failed, then the vehicle doesn't stop. It stops only when somebody forcefully stops or it meets in an accident. It is something like that. A car where the brakes are failed and there is some continuous acceleration mode. This is what happens in cancer cell. It spreads, ultimately it destroys the person. So this is what we tell as cancer.
Right, Dr. Santosh, thanks for that overview. Coming to specifically breast cancer, what are the risk factors involved? Like if who are high risk individuals, what increases an individual's chances of facing breast cancer?
Right. So breast cancer, if you see maybe around 2 to 3 decades prior, it was not the common cancer among women in India. But what we are seeing over the past 1 to 2 decades, many women are getting breast cancer, number one, and they are getting at a younger age group, number two. And owing to the neglect, they are detected at an advanced stage. These three are the main important pertinent problems that we are facing in India. Then we thought about why is this pattern occurring? What has changed over the past 2 decades compared to previously? So we thought understanding that there is lot of adoption of westernized way of living. So we have entered to the era after 2000 into the new millennium where westernization of the things in our day-to-day lifestyle in the form of our food habits or the way we work or we go to job or the jobs have increased in the IT sector and all, which sometimes simulates more of sitting kind of working. And at the same time, with the associated multinational companies, where they interact with their Western colleagues, they adopt somehow their lifestyle. There is intermixing of this. This is, according to me, one of the major impact that cultural change has got increased incidence of breast cancer. At the same time, the problem is in the West, they have very good healthcare facilities. We have adopted their harmful lifestyle, but we are suffering with proper healthcare facility. This imbalance have further increased the breast cancer rate, and also more advanced cases of breast cancer are coming on our day-to-day things.
Come to the role of genetics and family history. What role does that play? And lifestyle, I will further down the conversation come back to that question also. But when we talk about genetics, what is your take on that?
So, as many people have a myth that genetics plays a major role in breast cancer. It's not like that. If we see approximately 100 cases of breast cancer, genetics play a role only in 5 to 10% of cases only. I want to clear this myth once for all that it is one of the minor risk factor. It is not a major risk factor. Why did it become famous? Because everybody knows famous Hollywood actress Angelina Jolie. So, in her family, there were multiple cases of breast cancer where she underwent a genetic test known as BRCA1 and BRCA2, after which she underwent a prophylactic bilateral mastectomy followed by breast implant placement. So, after this episode, many people started believing that majority of breast cancer are because of genetics. It's not like that. Only 5 to 10% are because of genetics. So, next comes who are the individuals who should be worried that they might have a genetically related breast cancer. So yesterday, one of the patient attendant came me. My family distant aunt has a breast cancer. So I'm about to be married. What are the chances that I would get breast cancer in future? What are the precautions? So what I would tell, if immediate first and second generation relatives have a breast cancer, and if they have a breast cancer less than 50 years of age, and multiple family persons, your aunts or uncles, have multiple site of cancers, then possibly these are genetically related to one. If somebody has a distant aunt having a breast cancer, then it's not genetically related. We have to see how close the relative is, first thing, and also at what age they have developed breast cancer. Suppose a person develops a breast cancer at 70 years, it is very unlikely that it is genetically related. The family people might not be worried. They might have the same risk as the entire population. They might not have an additional risk because their immediate aunt has a breast cancer at 70 years. It has to be seen as at what age the patient has, what subtype, and how many members, and how close the person is. Overall, if we see, it contributes to only 5 to 10% of all breast cancer. It's not like 50 or 60%. So, no need to be worried. So, it carries only 5 to 10% risk if we see all breast cancer, that is genetics.
Genetics, right. So, touching upon the lifestyle aspect, because you specifically talked about adopting Western values and cultures. So, do you think late marriages, late motherhood, then not feeding the child, do they play an important role when we talk about the increase in numbers, especially urban lifestyle?
So this is a very, very important question. So I would give you a small concept how to understand this. So the hormone that is present inside a woman is estrogen and progesterone. Estrogen is food for breast cancer cell. More amount of estrogen in the body, more the chances that higher the breast cancer incidence. Progesterone is somewhat protective. During pregnancy, during lactation, estrogen comes down and progesterone increases. So this balance, what happens is it's protective for breast cancer. So in patients, in persons who do not give breastfeeding, or there is nulliparity, or they do not have children, the chance of breast cancer is very, very high in them compared to a normal population. Also, this is because they have more time that the body cells are exposed to increased estrogen, because pregnancy and lactation automatically lowers the hormones and it prevents. So one more risk factor it has been scientifically seen is age of the first childbirth. If it is more than 35 years, those people might have slightly increased risk of breast cancer compared to other phenomena. All these points out to more estrogen. And one more important pattern we are seeing is after menopause, few of the women are adopting to hormone replacement in the form of estrogen replacement. This is we call as hormone replacement therapy. It is also one of the major risk factors. So westernization happening in our India is avoiding breastfeeding. That is one we are seeing. The second thing is nulliparity. So that is the second thing. And third thing is advancing age of the first childbirth. These three have subtle increased risk of breast cancer, and most importantly, hormone replacement therapy, especially after menopause, which has been adopted after watching a lot of Hollywood actors and all. Even after 50 years, they try to be in a more subtle way, which is not natural actually. So this results in more incidence of hormone replacement therapy and ultimately increasing the breast cancer risk.
Dr. Santosh, if we come to the detection part now that we have covered most of the risk factors, and detection की अगर हम बात करें तो one of the reason that you also spoke about at the start of the discussion is that women come at very advanced stage. If we talk about the way it is in India, so early detection, how is that possible? Like, what according to you is the benchmark? At which age should women go for screenings, and how is that implemented?
Right. So there are two major roadblocks not pertaining to breast cancer, any other malignancy. So one thing is this might not be a major problem. The patient self-educates him or herself. And the next is they approach immediate family members or friends who are not the proper person, where there would be a lot of delay. So there are many patients where they have noticed a breast lump maybe 1 year back. So I would ask them, what did you do for past 1 year? So I have consulted my friend who tells that these kinds of lumps come and down, so nothing to worry. So these kind of things are happening a lot. So for me, the most important is early detection and also screening. Early detection is suppose you see any new changes in your breast, immediately you have to report to a qualified person. It's not that you would ask your friend or someone. Always it is important to know what is normal and what is abnormal. 99% of the times it might be normal, but we do not want to miss even one abnormal case because there are a lot of fibroadenomas which are a benign breast diseases that happen in the reproductive age group. But for that to tell it is normal, nothing to worry, a qualified person, qualified doctor is the one you should assure you. That is one thing. So don't neglect any new symptoms. That is the first thing. Second thing is screening. Screening is finding a disease when there are no symptoms. That is the meaning of screening. Because sometimes small nodules inside the breast, because of the lot amount of fat tissue, it might be difficult picking even when we do monthly self breast examination, and also for doctor also it might be little bit difficult. For them, we suggest mammogram once a year, at least start after 40 years. This is what we suggest. Mammogram is a very simple procedure. It takes hardly 3 to 4 minutes. Mammogram is nothing but taking an X-ray of the breast. And many people are of a concern, or it is a myth that mammogram, more amount of radiation increase the breast cancer. It's completely false. Mammograms helps us to detect breast cancer at an early stage, and it saves many lives, and there is no increased risk of radiation and all. So one more confusion is patient undergo ultrasound and consider it as a mammogram. Mammogram is an X-ray specialized investigation. Do not confuse it with ultrasound breast. Ultrasound breast is separate. We have to do a proper mammogram to identify in an early stage.
Santosh, you talked about how it is said that no mammogram, yeah, X-rays increase the risk. So when we talk about cancer and breast cancer, to be specific, there are a lot of myths and misconceptions that people have. You must have noticed in your practice also. So some of us, if you had to tell us as the most, people think about this as the most important factor, and it is not true. So what are some of the myths and misconceptions that you have seen in your practice that women believe about breast cancer?
So one major myth that detriments the prognosis is whenever we need to confirm a cancer, we do a biopsy. Many people have a concern that biopsy spreads the cancer. It's not at all. Don't be in that misconception. Biopsy helps us to facilitate good diagnosis, early diagnosis, so we can act upon. So, for any cancer treatment to initiate, we need to confirm the diagnosis. It is by biopsy. No need to worry. Biopsy is a simple, painless procedure, and it hardly takes 4 to 5 minutes for a biopsy. So, biopsy doesn't increase the spread of cancer. It is only a myth. So once for all, again, from your platform, I want to reiterate the fact that biopsy doesn't spread the cancer. In fact, it is a stepstone in the successful treatment of a cancer patient. Once we diagnose early, we can treat early.
Dr. Santosh, depending on the, if you could just take us through the different stages of breast cancer, and depending on the stage, what treatment option is, though now we talk about individualized treatments and how new and innovative treatments are there, which we will cover in the later part of the discussion. But when we talk about different stages and what are the treatment options that are sought after for those specific stages.
So many people do not understand what is this staging and all. So stage, to simplify and tell in common words, how long has the cancer cell has traveled from the start point, that is from the breast. So when it arises from the breast, has it been restricted to the breast cell, or it has moved from the breast and spread to other parts of the body? This information is what the stage gives. To briefly tell, there are 4 stages in breast cancer. Stage 1 means the size of the tumor is small and it is restricted to the breast tissue. In stage 2, the size becomes a little bit bigger compared to smaller size. Stage 3, the breast cancer cells starts moving from the breast. They go to the axilla. We have lymph nodes in the axilla. They can move to the center part of the chest where there are lymph nodes. Lymph nodes are nothing but roadblocks for spread of cancer cell. So they try to control the cancer cell there. Once there are involvement of lymph nodes, we call it as a stage 3. Once the breast cancer cells spread to other parts of the body, suppose cells from the breast cancer breast spreads to the lung or liver or bones or brain, other parts, when we call it as stage 4. Stage 4 is also known as advanced breast cancer. In stage 4, the patient might present to us with symptoms of the particular organ it has. Suppose if it has spread to the bones, patients would come with complaints of low backache. So these are the way stage gives us an information how far the cancer has spread inside the body.
Coming to the treatment options, Dr. Santosh, there are new therapies that are there, immunotherapy, how genomes play a role. So what, according to you, is one, breakthrough that you think will revolutionize the whole, early detection and diagnosis, if we talk about breast cancer specifically?
So coming to the treatment perspective, conventionally, whenever you meet or discuss with an oncologist, there are 3 major kinds of treatments. That is chemotherapy, radiation, and surgery. Surgery is the cornerstone of all treatments. We have tried to remove the cancer cell by surgery. Recently, we have 2 important approaches that have come. One is the precision therapy or targeted therapy. The other is immunotherapy. So these are the 2 armamentariums that have joined the existing 3, which have brought landscape changes in the treatment of breast cancer. Coming to the precision and targeted therapy, we do biopsy. On this biopsy, we run some advanced molecular tests by immunohistochemistry and next generation sequencing. We identify what problem is there in this particular kind of cancer cell. Based on that, we modify our treatment. Instead of giving chemotherapy, we give targeted therapy so that our medication will go and hit the specific target on the cancer cell, not on the healthy tissue. For example, there is a molecule known as trastuzumab. This trastuzumab goes and attacks breast cancer cell where there is HER2 positive. So this is advanced. Recently, we have the most advanced version of trastuzumab that we call as trastuzumab deruxtecan. It is a latest class of molecule where it combines the approach of chemotherapy and targeted therapy. That is, it is like a payload. In missiles, we see it has a radar, it goes and hits the spot where it releases the chemotherapy. So what happens with this trastuzumab deruxtecan is it goes near the breast cancer cell and there it explodes. So that the chemotherapy load is delivered to the cancer cell and not to the normal cell. By this, we can expect highest response rate without major side effect. The second advance is the immunotherapy. Normally, our body immune system is to recognize and control any infection. What happens with immunotherapy is this medication treats our immune system that you have to go and catch cancer cell and treat. So these are the two approaches. We run genetic tests in the form of BRCA1, BRCA2, check, PALB2, RAD and all. If they are positive, we offer these patients some tablet form of therapy known as olaparib. So this tablet works in those patients who have BRCA1 and BRCA2 patients. Another advance is preventive oncology. As I told you, these are all treatment perspective. If a patient in a family has BRCA1 mutation, we run BRCA test in their relatives and other family members. If they are positive, we offer them prophylactic surgeries in the form of bilateral mastectomy and bilateral oophorectomy so that they would not develop breast cancer in their lifetime. So these are the major advances. To reiterate again, targeted therapy or precision therapy, immunotherapy, this preventive oncology where uh, understanding even before development of cancer and doing some measures so that they will not develop cancer in their whole lifetime.
Dr. Santosh, that was a very insightful answer, and you have covered most of the aspects of treatment. If we talk about coming to the Indian scenario, you think there is this lack of knowledge and awareness where, this stigma around women's health, women do not openly discuss about their, reproductive issues or any other health issues as such. They don't even prioritize their health. You think that that stigma taboo is there, still there, and that is a significant factor when it comes to late detection? What is that true according to you?
So there is a significant amount of social stigma and taboo that I should not express or meet a doctor or tell. This is happening at the same time. Western lifestyle in US, that's what I was telling. They also have the risk factors. They openly go and meet the doctor or physician immediately. We are adopting the risk factors, but not their good habits. That is what happening. So Indian women are very, very conservative. Whenever they get a problem, they do not report early. They have a notion that this will be cleared by next 1 month. We will wait and what? It's not causing me any pain. It's just a small lump. Let it go. It's on and on. And they would hear from their friends or their aunts or their mothers or their elders in the family. These kind of thing happen in breast during menstrual cycles and all. No need to worry, it would disappear by next cycle or something like that. This notion should be removed. This is present predominantly in India, and it's surprising to see that these kind of notions are there in the most educated and the women who are in higher positions also. It's surprising to know us. So there is an intense need to propagate the true information and eliminate the false information and myths. Any breast lump, you go and meet a qualified person, examine and do tests accordingly. If it's normal, he himself or she himself will tell that you observe nothing to do. But it is very, very important that a proper, a qualified person addresses the needs. There is no scope of self-medication or self-suggestion or suggestion by quacks. Every person in India is a doctor. If you go to the medical shop, instead of visiting doctors, our people believe in medical shops and go, "अरे मुझे ये हुआ, इसके लिए tablets दे दो." So because of this, we are seeing lot of delays in approaching to the doctor. And one point you have asked why there are advanced stages more in India in cancer. The reason being is we do not have a proper effective screening strategy and patient reporting symptoms to doctor. It is very, very delayed. So they have symptoms maybe 6 months, 8 months back until they reach oncologist. By the time the bus has already left the station. So this is what's happening in India. According to me, we need support of channels like you, organizations like you, where we need to disseminate the information even to the most educated and most qualified person, proper information should go. There are a lot of pseudo influencers or social media influencers who give false information and they will have, listening to them, many patients would have false sense of security. That should be eliminated.
Dr. Santosh, when we talk about lifestyle changes, what would be some of the preventive aspects that you would advise women to, to take in order to mitigate the risks of breast cancer?
Right. So it has been observed that obesity is one of the risk factors for breast cancer, especially in postmenopausal age. Obesity increases the estrogen hormone, which is like food for the breast cancer cell, as I told you. We have to adopt measures to prevent and control obesity. And for that, you don't need to do exhaustive exercises or joining gym. So what recommendation is that at least 20 to 30 minutes of walking, brisk walking, 5 times a week. That is sufficient. No need to do all the days. So be regularly doing this. And second is avoid ultra processed and high fat diet. So that is the second risk factor. And alcohol and smoking are one of the risk factors for breast cancer. Even alcohol in moderation is not at all useful. Many people self-suggest themselves that they heard somewhere that taking half peg per day is okay. So they what they do is they tell, "Arey, somebody doctor has told you that taking half a peg is in fact healthy for heart, healthy for body." This is what they self-suggest and do. So according to me, this is also a myth that should be removed. So alcohol, smoking avoided, and engage in some form of activity and cut down the fats, increase the fresh things, no processed juice or no processed meat, or do not take processed foods. So take fresh, which we can take with our availability. It increases the oxidants, antioxidants in the body so that it quenches the harmful chemicals that are released. So that this one. So engage in a good physical activity. And one more thing is, because of the uneven shifts and all, there is a lot of mental stress in many of the people. Although mental stress is not a causative factor for cancer, but because of mental stress, they are unable to resort to this. So, because of the stressful environment, they would take fast, ultra processed food. And whenever they are in mental stress or mental pressure because of work or any other issues, they delay appointment to the doctor. It has indirect influences on the preventive behavior and many aspects. Although it's not a directive causation, it is an indirect. Maybe they would not report symptoms to the doctor, or they take time, and the investigations that the doctor suggests they might not do. So this is an indirect association. So food, exercise, avoid alcohol and smoking. If we do this, you can prevent almost 60 to 70% of cancers, according to not only breast cancer.
Right, Dr. Santosh. And before we leave you for the day, we would want a takeaway message on Women's Day. It was International Women's Day, and of course, when we talk about something like breast cancer, what is the importance of family support, your partner supporting you, your family being there for you? So, under that light, if you could give a takeaway message for all our audience there.
Yes. So breast cancer diagnosis is not a single responsibility, it's a family responsibility. Your partner should be enabling in detecting, and also the family should be conducive so that the symptoms are brought up early. So that is the first thing. If I want to give you one or two messages or take home point, one is do not neglect any symptoms. That is first one. Second is do monthly self breast examination after the cycle you have to do. This is the second thing. The third thing is mammogram after 40 years, once a year. So these are the three important things. If there is a family member with breast cancer, especially if they had a breast cancer less than 50 years, then we do genetic testing. These 4 points, if we do and adopt a healthy lifestyle, that is, take good points from the Westerners. So they approach to the doctor as and when they get the smallest of the complaint, and also they do regular screening mammogram. So not only adopt Westerners, but also take good aspects from Westerners and retain the good values of Indian system. So this is what I would tell. So that we can diagnose at an early stage and prevent it. And also, suppose it has come, we can identify in an early stage. We can completely cure it rather than diagnosing in advanced stage.
Santosh, thanks for your time, and I'm hopeful that you spoke in such a nice manner. Our audience will take away a lot of relevant information in the most simplest of language, and it was a pleasure having you amongst us.
Thank you. Thank you for having me. It was an indeed a great talk and discussion with you. So you brought forward what are the common doubts that a common person
Everything having
faces.
about
This
breast
is what we need. So they ask us what food to take, what food not to take, how to diagnose and all. I really enjoyed participating and conversating with you. I hope all our audience will educate themselves and
cancer. Lot
understand
of
what are
relevant
the intricacies and how to prevent and early diagnose breast cancer.
breast
This,
cancer.
thank you very much again for having me.
Thanks for being with us for this very insightful discussion. And dear audience, that's all for today. But keep on following our social media pages for more updated information on health and well-being. Thank you, Dr. Santosh.